Welcome back, everyone. Today we are talking kids with Dr. Caitlynn with Lexington pediatrician Dr. Caitlynn Iddings. So it's that time of year again. The fall season is upon us. So today we're talking about the very timely topic of fall allergies. Dr. Caitlynn, good to see you this morning.
Good morning.
I was just telling her in the break, I'm dealing with allergies. I feel like everyone in the entire region is dealing with them right now. So this is a very timely topic. Okay, the question everybody has, is it a cold? Is it allergies? How do you identify that your child is dealing with true allergies?
Yeah, and so typically, when you're little, like when you're under age 1, the likelihood of having allergies is pretty low because you kind of have to live through an allergy season to get sensitized. Okay. So, you know, if you're 2, 3, 4, and suddenly you see this pattern of like every fall, suddenly this kid just gets this pouring nose and it lasts for weeks, and they're miserable and they're itchy and just like continuing on, then that could be a sign that they are suffering from some fall allergies. Okay. The big ones in Kentucky, I mean, Kentucky, Lexington, Bluegrass area is the allergy capital of the world. So, but the big ones that we get this time of year are ragweed. Now we still do have a lot of pollen going on, although it's lower lately and the rain hopefully vamped that down a little bit too. But the ragweed really starts to come out this time of year and can cause a lot of, you know, distress and wheezing, and asthmatics can come in all, you know, worked up and needing to get steroids and all sorts of things. And so, trying to tease it out from a cold, though, at first can be hard because they can be very similar, right? So
especially if they're young and this is kind of the first time you're dealing with them.
It'll start with just a clear runny nose. Maybe they have a little bit of watery, itchy eyes, sneezing. That can happen with a cold, too. Usually a big differentiator would be like, you know, there shouldn't be any fever with allergies. So if your child has a fever, that's a sign that, okay, it's probably a virus or some sort of cold thing, right? If your child is having, you know, prolonged symptoms, trying to tease out, like you said, okay, has this turned into something bacterial, like a sinus infection? Has this turned into, you know, bronchitis, ear infection, pneumonia? So I always say if things have been going on for longer than 10 to 12 days, you know, if it's been 2 weeks and you're like, it went from being really clear to now they're just gagging on stuff, they're real thick snot, then we want to see them just to make sure they don't need an antibiotic. But there are some things you can try in the meantime. If they're under age 2, we always advise you to ask your pediatrician first, right? But usually kind of first line would be something like a 24-hour antihistamine, okay? So you have things like, you know, Benadryl, which are those short-acting antihistamines that tend to kind of knock you out. So we don't encourage to give your child that first thing in the morning because they're going to fall asleep in their Cheerios or on their math test, right? But, you know, usually antihistamines are pretty benign, and they have the appropriate dosing on the bottle. But if you have any questions about that, you know, asking your pediatrician to make sure that's what's right for your kid. There's multiple options out there. I always say it doesn't have to be brand name. You know, just something that's a 24-hour antihistamine that's going to kind of give them that control throughout the day. If they're having a lot more congestion, runny nose, maybe the antihistamine isn't cutting it, adding on a little steroid nose spray. So these are indicated for over 3 years of age. So if they're having just, you know, a lot here, or some kids can't tolerate antihistamines, they get this paradoxical reaction where it hypes them up and they get really hyper. And so sometimes this can be a good option to kind of control symptoms here and make sure it's not draining down the throat and causing that constant cough, 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 cough. And then some kids get really just, we've talked about, you know, there is allergic pink eye, right? So some kids will get like these pink eyes and they're just watering constantly, and it's usually not that thick, goopy drainage, but you know, doing like an antihistamine eye drop can also be very helpful for those kids just to kind of help control symptoms.
Antihistamine eye drops. Oh, I didn't even know there was such a thing.
And so that's always kind of first line, is to try those things first. If you've done that for a week and you're like, oh my gosh, my kid is just still miserable. They're starting to spike little low-grade fevers. They're not eating well. You can just tell they're just really feeling bad. Then it's like, okay, you need to bring them in. We need to see if there's something else we need to do. Time to head to see your pediatrician because it could be something else. All right, it's allergy season. Do what you can to keep you and your child feeling okay. Good to see you this morning, Dr. Caitlynn. All right, stay with us, everybody. You're watching ABC 36. We'll be right back.